new studies may explain why so many persons of color are dying from COVID-19, the dreaded disease caused by the coronavirus. A local doctor is reviewing the data, which could lead to a game changer in this disease that claims the lives of thousands of Americans every day. Regina Mobley has this story tonight. Regina?
Well, Tom, a local doctor, but not your average doctor, is spreading the word about something you may have at home or you can easily find at your local drugstore that could make a difference in controlling the disease that kills twice as many persons of color.
I got to thinking, who is more seriously affected? Who has the worst outcomes in this COVID crisis? It is our Black and our brown folks that have a greater risk for infection, greater levels of infection, and when they do get infected, they tend to have worse outcomes.
For a decade, she has helped to solve some of the state's most horrific murder cases. Now, Dr. Leah Bush, aka the Doctor of the Dead, former chief medical examiner for Virginia, is working to solve the coronavirus mystery. A recent study shows 64% of non-Hispanic blacks, 29% of Hispanics, and 14% of whites were vitamin D deficient.
But when you look at insufficient vitamin D, meaning the levels are low but not deficient, then we're up to 84% non-Hispanic blacks, 56% Hispanics, and 35% whites.
Vitamin D3 needed for a healthy immune system is added to milk and is formed by exposure to the sun. Is there something about the melanin in our skin that blocks that absorption rate?
It has been shown that both Black and Hispanic populations synthesize vitamin D at a much lower rate.
But that's not all.
Many Black and brown folks, as we know, are lactose intolerant. So they don't go and drink a quart of milk a day, which is all vitamin D fortified.
Minorities are at risk of low vitamin D, and so are older Americans. You make less vitamin D from the sun as you age. Contact your doctor for more information, but Dr. Bush is recommending persons of color and the elderly take 1,000 to 2,000 international units per day of vitamin D3. Dr. Bush also recommends asking your doctor to test your level of vitamin D, since you may need more than the 2,000 IUs each day. We have many more details on WAVY.com. Regina Mobley, 10 on your side.